Good day, everyone. My name is Christine Alan Sumawang, a student nurse from Tarlac State University from BSN 1B. And for today, I will be performing a performance checklist about the moving of the patient up in bed with the assistance of another nurse. So first thing that we need to know is the goal of our performance. So the goal of our performance is that the patient remains freely or free from any injuries and the patient maintains proper body alignment. So now we will proceed to our procedure. First thing that we need to know or we need to do is we need to assemble our equipment. We do need to have a friction reducing sheet or other friction reducing devices. We also do need to have a non-sterile gloves as indicated. And after that, we also do need to have an additional nurse or a caregiver based on assessment. And for our last equipment, we do need to have a full body sling lift and a cover sheet based on assessment and based on availability. And now we will proceed to our implementation phase. So first thing that we need to do is we need to review the physician's order or the medical record and the nursing care plan for any conditions that may influence the patient's ability to move or to be positioned. After that is we need to assess tubes, IV lines, incisions, or other equipments that may alter the positioning procedure. After that, we need to identify the movement limitation of our patient. And for our second step, we need to perform hand hygiene and we need to observe other infection control procedures. And we also do need to put on PPE as indicated. Now for our third step, we need to introduce ourselves to our patient and we need to verify the patient's identity. After that, we will need to explain the procedure with our patient. So, good day ma'am, my name is Chris Lam Sumawang and I am a student nurse from Tarlac State University and also for today, I will be your student nurse. And ma'am, may I know your name po? Okay. Ma'am, may I see your name tag po? Okay, thank you po. So today, ma'am, I will be assisting you and moving you up in bed. Is that okay with you po? Okay, thank you po. Now we will proceed to the giving the patient some privacy by closing the curtains around bed or closing the doors to room if possible. We also do need to place the bed in a comfortable and in appropriate working height, usually elbow height of the nurse. So let's assume that I have already placed the bed in a appropriate and comfortable working height. Next step is we need to adjust the bed into a flat position or as low as the patient can tolerate it, placing the bed in a slightly Trendelenburg position, aid movement, if the patient is able to tolerate it. So let us assume that I have already adjusted the bed. We will now proceed to our fifth step. We need to remove all the pillows behind the patient's back and we need to leave one pillow on the head of the bed leaning upright against the headboard. So ma'am, tatanggalin ko lang po ang pillow po sa likod niyo po. Is that okay po? Okay po. So as you can see here, I have already leave one pillow on the head of the bed. Now we will proceed to the next step, which is we need to position at least one nurse on either side of the bed, and we will need to uh, have the other nurse and myself to lower the bed rails. So, for example, we have already lowered the both the side rails of the bed. We will now proceed to the next step which is, if not already in place, we will be placing a friction reducing sheet behind or under the patient. So, as you can see here, the friction reducing sheet was already been placed. So we will now proceed to our next step, which is we need to ask the client to cross his or her leg and his or her feet flat on the table to assist with the movement. So, ma'am, can you please, kaya niyo po bang cross po yung inyo pong leg, and yung feet niyo po is i-flat po natin? Okay, thank you po. And for our next step, we need to have the patient to fold his or her arms across his or her chest, and we need to have the client to lift his or her head with his or her chin on the chest. So, ma'am, kaya po ba natin i-fold yung ating pong arms po? Okay, thank you po. Yung chin po natin, kaya po ba natin ilagay sa head, sa may chest po natin? Okay, so, thank you po. Now, we will proceed to our next step, which is we need to put one nurse on each side of the bed with their both feet spread out about the shoulder width of the nurse, and with their one foot ahead of the other. And after that, which is our next step, we need to, if possible or if available to our bed, we need to engage the bed mechanism to make the bed surface much firmer. And let's assume that our equipment has can engage to bed mechanism, and I have already placed it, let's assume, and we will now proceed to our next step, which is we need to grasp the friction reducing sheet securely close to the patient's body. So let's assume that my coworker is on the other side. We need to both to grasp the friction reducing sheet close to the patient. So let us assume that we have already grasped the friction reducing sheet, and after that we will need to flex our knees and hips, and we need to tighten our gluteal and abdominal muscles, and we need to keep our back straight. And after that, we will need to shift our weight back and forth to our back leg to our front leg, and we need to count 1 to 3. On the count of 3, we will be moving the patient up in bed, and if possible, the patient can assist with the move by pushing his or her leg. And we need to repeat this process if necessary to get the right position of the patient. So, for example, the other nurse is in here. We will be pulling it on the count of 3. So, ma'am, we will be pulling na po yung ating pong friction reducing sheet, and we will be doing it po on a count of 3. So, 1, 2, 3 po, we will be moving yun na po. So, okay, let's start po. Is 1, 2, 3. Okay. So after that, we will proceed to our next step. That is, we need to assist the patient in a comfortable position, and we need to readjust the pillows or other supports if necessary. And also we need to uh, return the bed in its normal settings, and we also do need to uh, lower the uh, lower the bed on its lowest position with the rails up. And after that, we will need to uh, for our next step, we will be needing to uh, clean transfer aids as per facility policy, if not indicated for single patient use. And we need to remove our gloves and our PPE if used. And after that, we will be needing to perform hand hygiene. So for our evaluation, the expected outcome is met when the patient is moved up in bed and the patient uh, is free from any injuries, and the patient demonstrates proper body alignment and is comfortable and demonstrates an intact skin without any evidence of breakdowns. And also for our documentation, we need to provide areas on the bedside flow sheet to record the repositioning. After that is we need to demonstrate the time that the uh, patient's position was changed and the use of supports. Also the uh, any pertinent observations, which includes the skin assessment. And we also do need to um, document the patient's tolerance to position change. And after that, we need to document the aids used to facilitate the movement. And that would be all for the assessment of the performance of the moving of the patient up in bed with the assistance of another nurse. That would be all. Thank you.